Welcome to Oyate Today. Oyate in Lakota means people. Brought to you by Native Sun News Today. Hi, my name is Richie Richards. I am your host of Oyate Today, a program produced by Tim and Jackie Gallego. Today we have a very special guest in Mike Diedrich, who happens to be the Vice President of Regional Health Governmental Relations. And so, Mr. Diedrich, if you could kind of give us a little bit of background information on your professional history. I know and understand that you were a senator for a number of years, so if you can just touch on that and let us know a little bit about where you've been in your career.
Well, thank you. Well, first off, I'm honored and privileged to be here with you, Richie, and look forward to our discussion. My professional career is I'm a lawyer by training. I'm an advocate for good public health policy. I've been engaged in the South Dakota State Senate. I served 3 terms there. I had the privilege of serving with Senator Tom Shortwell during that period of time. We have been engaged with regional health and governmental affairs on the federal, the state, the tribal, the agency level, and the local community level. I'm involved in all of that.
Oh, that's good. How long have you been with regional health then?
Well, I have been with Regional Health. I served as a member of the board of directors for 8 years, and then a position opened up in the legal department, and I decided to roll the dice, put in an application, and resign from the board. And I've been with Regional Health I'm in my 7th year as an employee.
Well, we're glad to have you here, Mr. Senator, so I appreciate your time as well. In our pre-interview discussion, we talked about some of your work as a lobbyist. We talked about some of your work in regards to the discussion behind American Indian healthcare in western South Dakota, and we talked about some of the inevitable changes that we foresee in the very near future and the long distance future. So could you kind of touch on some of your work as a lobbyist in regards to that?
Well, the one thing that's constant in healthcare today is uncertainty. And so uncertainty comes to healthcare for all populations, and for us in western South Dakota especially, as it relates to the congressional efforts to repeal and replace or make some changes in the ACA, as it relates to the opportunity, or it may be eliminated, opportunity to expand Medicaid in the state of South Dakota, as it relates to the way IHS as an agency operates its healthcare system. And that's all impacted by committee hearings on the Senate Committee on Indian Affairs, by the Government Accountability Office report in 2016, and the OIG report on Indian health in 2015.
And so in regards to some of these changes, we had also discussed the possibility of IHS is in kind of a period where closing and possible closings are going to be happening. I know that the ER up at Susan here in Rapid City had closed in September of 2016. And so in regards to that, do you see what is your main concerns for American Indian healthcare, and what should we as American Indians ourselves and family members that are dealing with healthcare issues be concerned about, and what are some of those concerns that you kind of foresee?
For American Indian healthcare, there will be anticipated changes in the way IHS administers the program. There will be funding challenges, as always. It's underfunded. If you look at the average amount that a beneficiary of IHS is spent on that is about $3,500. When you look at Medicaid, it's closer to $5,500. Medicare is higher, but that's a more elderly population. That's closer to $1,100. VA is around $700 or $800, or I'm sorry, $1,000 per year.
Per year,
yeah,
per
each
patient.
Each one of those are $1,000.
Awesome. In regards to some of the resources and some of the funding issues around IHS and IHS reform, what are some of your concerns with that specifically? Where does the funding come from to help with American Indian healthcare in western South Dakota?
Well, the IHS budget is a total of $6.2 billion for 2016. I mean, it's $6.2 billion for 2016. And of that, about $4.4 billion was allocated funds, and the other additional funds were from third-party collections, where services are provided and other insurers that may provide care be responsible for those costs, then reimburse IHS for their expenditures. So it's a total of about $6.2 billion budget. Allocation is based on the service areas. There is no clear funding methodology for how PRCs are funded, so it's more of a historical or a legacy. It does not take into effect or consideration the increase in population or the change in demographics or the change in the economies. And so the way those funds have been distributed to the service areas has not changed over the years, and it probably no longer reflects the needs.
And so with the fluid population of American Indians living in Rapid City, we have those coming on and off the reservation at all times. Does that affect any of the services provided by Regional Health, or is there any kind of efforts to kind of deal with that fluid population that does tend to go back and forth from the reservations in regards to services provided and recovery of those expenses?
Yes, the population served by Susan, for example, is approximately 20,000, 21,000. The overall population in western South Dakota served by IHS is around 70 to 75,000. And that doesn't account for enrolled members that come from different parts of the country. And so it has an impact on Regional Health because the patients will come and present themselves to Regional Health as IHS eligible patients, but the local service units are not responsible for their care. They don't have the PRC dollars for those. Their PRC dollars are for members that are enrolled within their unit. And so we have quite an influx. If you look at the Susan website, they said that they serve over 200 different tribes, members of over 200 different tribes in their area.
Throughout the year?
Yeah. Okay. There's a lot of travel, a lot of people come and visit.
Yeah, with the tourist population and stuff. Okay. We touched on your relationship with Susan, in particular with Bernie Long. And so could you talk a little bit about the relationship between Regional Health and IHS, in particular with Bernie Long, please?
Well, Bernie Long is the acting CEO of Susan. He has really good experience, and he's a good man. I think he's an excellent choice for that, and I hope that he becomes eliminates the acting title and becomes the full appointment. Bernie is creative. We've talked about all kinds of different programs of how can we support each other, how do we increase the access and improve the outcomes for the American Indian population in western South Dakota. We talk about how can we share training, perhaps we share recruiting, what services are most efficiently and shared or maybe supported. Maybe we have a service that would be more efficient for them just to contract for, or vice versa, for Susan to contract for. We have also talked about community health, just population health issues and efforts to try to improve education and information.
With IHS being a federal institution and Regional being a nonprofit, what are some of the roadblocks, or what are some of those things that are challenging in regards to working with each other, sharing of services, sharing of providers and such?
Well, we have the common purpose of helping our patients and communities live well and providing good health care, quality health care, and providing the appropriate care in the appropriate setting. So we're all on the same page on that. We have the same goals and values. As two different entities, it's a challenge because IHS is a large bureaucracy, and I know that the leaders in the service units through the chain of command go through the service area, go through the national level, and it's difficult to make changes, and it's not an efficient process. Some of the things that, for just example of potential barriers, is it would be good to have an IHS patient navigator on site at Regional Health to help navigate the patient and to help make sure that the information and the medical records and everything is communicated well with the IHS physician.
So in regards to that, in regards to this navigator program or position, is there something in the works for that then, or how is that?
Well, we're working on a program like that. One of the challenges is Regional can't just give an office to or make space for an IHS or any other potential referrer to have free space in order to do their work there. That raises other federal statute prohibitions. Although it makes sense and it's common sense, there are some federal regulations that make that more cumbersome.
And we'll be right back with a quick word from our sponsors.
Closed captioning for Oyate Today, brought to you by West River Ear, Nose, and Throat.
Clark had joint replacement surgery 6 months ago.
In the end zone for the touchdown.
To his grandson, he is still the MVP. Black Hills Surgical Hospital, bringing more life to your years.
Our school has great students and dedicated teachers, but we need our community volunteers to help us to provide a broader view of the many ways a good education can point to a bright future.
Did someone say volunteer? Our team at Black Hills is here to help. In fact, we sponsor events and projects, and our employees volunteer for organizations throughout the Black Hills, including partnering with schools to help students learn more about life outside the classroom. Extracurricular, extra fun.
You can't predict life's ups and downs. You just give it all you've got to stay on top. But it's easier with a partner like Security First Bank. Since 1898, we've been riding with you through the country's biggest ups and downs. And this is where we'll stay. Security First Bank, a relationship you can count on. Member FDIC.
When I'm here, I win.
This fall, with a stay-and-play package, one great price lets you experience the best that Prairie Wind has to offer. Great gaming, delicious food, and a one-night stay. Only $99.99 Sunday through Thursday, $149.99 Friday and Saturday. Only at
Prairie Wind Casino. Feel the wind.
Welcome back to Oyate Today. We're continuing our discussion with Mr. Mike Diedrich of Regional Health. Some of the things that we're going to be talking about in this segment is some of the race relations initiatives and some of the working of Regional Health directly with the tribes and local tribes in western South Dakota. So, Mr. Diedrich, if you could tell me some of the initiatives that kind of stand out in regards to what Regional Health is doing to work and provide and foster those relationships with the IHS of, say, Pine Ridge or Rosebud or such.
Well, Regional Health has been very active in that, especially in the last 2.5 years. And one of the things that we are especially proud of, because I think it's very effective, is the Lakota Lands and Identities Tour. We've sent several busloads of our caregivers down on the tour, and the networking and the understanding and the collaboration that comes out of that is very impressive, because the spin-off groups from those networks of those individuals on those tours, they get engaged in many different little committees that do important work and good communications. We have been working with Sue San for years with meetings to talk about how do we help, how do we collaborate with each other, where could you use some support, where can we use some support. We work with the state. I'm on the South Dakota Coalition for Healthcare Solutions, and that is populated by members that represent the state, that represent legislators, represent the tribes. IHS is engaged on that. Great Plains Tribal Chairman's Health Board, Geraldine is there. And we have been working as a whole as how do we improve access and outcomes for all of the population of South Dakota. And we have focused quite a bit on the American Indian population as well. Regional Health is engaged in multiple communications, gatherings, celebrations, collaborations on both the local and the tribal level, and we continue to ramp that up. It's very rewarding. It's the friendships that are built are awesome, and the work that we can do, I think, will be incredible.
Could you expand a little bit on the relationship with Regional and Great Plains Tribal Chairman's Health Board a little bit more, and kind of give some information about what role that they play in some of these initiatives and some of the programs that may be coming out of Regional Health?
Well, when we talk about the challenges of healthcare, the disparities in healthcare that face American Indians in all over the country, but especially in South Dakota and especially in the Great Plains area, service area. And so Geraldine Church and the Great Plains Tribal Chairman's Health Board are very active in that, and they're very active in dealing with community health and diabetes programs and programs that we also have a high interest in spreading and supporting throughout all of our communities in western South Dakota. So it's good to be coordinated, aligned. We can coordinate resources, we can support each other. And then at a higher level, when we're talking about the Medicaid expansion, for example, and how would that work if the state were to take that step? How would it work, and how could we make it benefit the PRC program to provide more funding that would be available for PRC programs, because the state Medicaid program would be covering some of the care that otherwise would come out of PRC. So it ranges from levels from educating on the lowest level to identifying policy that we would recommend moving forward on the highest levels.
And I understand, well, pre-interview discussion, you had mentioned a bus that goes back and forth to Pine Ridge. Can you give me a little bit of information about that and share with our viewers what exactly takes place with that bus or that system?
The Lakota Lands and Identities Tour bus?
You had mentioned that there was a relationship between the IHS in Pine Ridge and sending providers down to...
Oh, certainly, I'm sorry. Well, Regional Health contracted for probably 6 years to provide specialty physicians on Pine Ridge and advanced practitioners and nurses to support the IHS facility in Pine Ridge. And that was a program that was very effective. Unfortunately, the contract ran out, and I believe the funding ran out. We still provide orthopedic support down there. And one of the big barriers, what we really need for transportation, one of the big barriers to access to health care is transportation. And that's one of the things that we've talked about in all forums of how do we eliminate some of those barriers, how do we improve, and transportation is one of them.
We had also talked about the uncompensated care or health care that's being provided by Regional. I know that there's a large, amount that Regional is kind of absorbing as a result of the issues with IHS, both on and off the reservation. Can you kind of elaborate on some of that a little bit?
Yes, the level of uncompensated care that Regional Health provides for IHS eligible patients that's not compensated is about $500,000 to $700,000 per month, and so it runs close to $6-7 million a year of an actual loss. That's the cost that we'd lose on that, and the uncompensated care that Regional provides throughout the whole entire population is very high, and it's virtually unsustainable. So we also have a high interest in fixing a lot of the access issues and the outcome issues, trying to make the scarce resources go as far as possible for our patient population.
Would that be the resources available through IHS then, or?
All of our resources, but especially IHS. And so had Medicaid expanded, IHS would have, our local PRCs would have more dollars to utilize for patient care, and they could pay beyond the top tier level. They could go down farther. Essentially, the only area that gets reimbursed, and it doesn't entirely get reimbursed, is basically life and limb issues, urgent emergency care. There's 4 tiers down that work their way down to dental. In the states where they've expanded the Medicaid, the PRCs have enough funds that they can provide that care to all of their members. In our state, we can't. We don't have enough funds in the PRC to do that.
Has Regional Health seen a kind of influx or kind of elevated number of patients coming as a result of these closings at IHS or other services provided by IHS?
Well, we have seen an increase in emergency department encounters. The emergency department at Susan closed on September 20, 2016, and we measured that to watch what impact that would have. As far as the inpatient population goes, the number of surgeries or inpatient referrals have been pretty consistent. So the impact in that area should be not as strong.
All right, we'll be right back with Oyate today after a word from our sponsors.
The first freeze has hit and winter is on its way. Be ready for our Midwest weather. Over 280 new and used trucks on our lot now with more traded in daily. Are you from Nebraska, North Dakota, South Dakota, or Wyoming? We want your trades. They are worth more to us than any auction vehicle. Check out this month's truck specials. Save $2,000 on these Chevy and Ford trucks. This 2008 Chevy Colorado now $79,888. This 2007 Ford Explorer now $11,988. This 2008 Chevy Silverado now $19,988. Feel the difference at Rapid Chevrolet, Rapid City.
Native Son News has been voted the best weekly newspaper in its class for 2015 by the South Dakota and North Dakota Newspaper Associations. You can find a copy of the Native Son News at many businesses and vending machines in Rapid City and the surrounding area, and on all 9 reservations. We publish every Wednesday, so advertisers and subscribers can reach our diverse readership by calling 605-721-1266. The Native Son News covers the other side of the story.
More than 2 million men and women have served in our military since 9/11. Now, many of them are transitioning back into civilian life. They're considering career options, writing resumes, starting businesses. ACP AdvisorNet can help. ACP AdvisorNet is a nonprofit online community where Americans can offer career advice to those who have served. Now we can serve those who served us by helping them to find their next career. Visit acpadvisornet.org.
Welcome back to Oyate today and our discussion with Mr. Mike Diedrich of Regional Health. One of the things that we wanted to focus on today, Mr. Diedrich, is the information and education that Regional Health wanted to provide to our viewers. And if you can just kind of elaborate on some of the things that you had brought along with you for our discussion today, and we can kind of go over some of those as part of our discussion.
Thank you, Richie. I think that our viewers really would be interested to know the disparity of healthcare in our area, and it's very important. And compared within IHS, the Great Plains area has disparities such as we have the highest diabetes death rate, we have the highest TB death rate, we have the second highest infant mortality rates, we have the second highest alcohol-related deaths. And in addition to that, we have the lowest life expectancy of an American Indian in the Great Plains tribal area. And you add to that the fact that we have the worst economic conditions. We're two of the poorest counties in the country here, and the need to address those issues in a early stage before those issues become chronic or acute. In the long run, an investment in that will reduce the cost of health care and make the scarce resources go much farther for the delivery of care and the improving in outcomes in our area.
With, as you mentioned, having 2 of the poorest counties in the United States, would you feel that Western South Dakota healthcare in regards to American Indians is at a crisis level, or where do you see it in regards to that as a pandemic or possible epidemic? And can you elaborate on some of that as well, please?
Well, I believe it's at a crisis level because CMS, the Centers for Medicaid and Medicare Systems, is the overall, our overarching umbrella organization that oversees healthcare in the United States. And they have closed down at different points, Rosebud, Pine Ridge, Sioux San, and Winnebago facilities. They've reopened them under certain conditions with system improvement agreements to address the conditions. It's a crisis because the resources aren't available to make these systems work the best. It's difficult to recruit physicians. It's difficult to retain them and other caregivers. It's difficult to provide facilities that are the state of the art. It's difficult to even provide safe facilities in some extent. And the CMS looked at that. And they're working through, IHS is working through addressing those issues. But it's at a crisis point because if those issues aren't addressed to the satisfaction of CMS, the accreditation would lose, and that would be a huge funding source loss for all of those facilities. In addition, though, and more importantly, that would be a reduction in the access points for health care for American Indians. And just like all of western South Dakota. We're a rural state, and if any access points we can increase are great for population health. Any that we lose are going to be a problem.
So in regards to this possible crisis prevention or crisis intervention, what kind of advice would you give to those working in the healthcare field, whether they're providers to administrative level providers or facilities? How can we, and also what role does American Indians and, just as patients, what role can they play in regards to some of this crisis that we're currently in with healthcare?
Well, I think the patient voice is a strong voice, and it needs to be heard and continue to be heard. It has been heard, and it needs to continue to be heard. The role of the government really should be to increase the funding. The role of IHS should be to efficiently use that. The administrative burden for the Great Plains tribal area out of their budget is about 2/3 of it is spent on administrators and 1/3 on caregivers. And so some would say, the GOA said that's a problem. The number of physicians budgeted for the Great Plains area in the last statistics I saw within the last 6-9 months was 177 physician positions open, of which only 73 physician positions were filled. So that's a 50% shortage of the physicians that the system has determined appropriate to provide care. And so there's a lot of challenges regarding recruit and retention. My advice would be, it's a great field, it's a great area to get engaged as a profession. There are lots of programs open that provide scholarships, especially for American Indians who want to get into that profession. There's a lot of support. Dr. Don Morton is on our board, and he's with the University of North Dakota. And he is very engaged in identifying those areas of support and increasing caregivers to enter the profession. We do regional health, has had over 200 high school kids come and shadow jobs in regional, and they come from all over, primarily reservation cities, high schools. And we show them what it is, what they can get into. We just need people that have open hearts, passionate hearts to come into the profession, who want to help people.
Mm-hmm. Is there a specific program in regards to retaining Native American students in the healthcare field that you're specifically proud of?
Well, we support the scholarship programs that are out there, but the federal government has changed it in the last couple of years. There are some loan forgiveness and tuition forgiveness and other programs available. So there's ways to make it affordable.
That's good. I want to thank you for tuning in tonight to Oyate Today. I want to thank our guest, Mr. Mike Diedrich. I would like to thank our sponsors, our producers, Mr. Tim Gallego and Jackie Gallego. And thank you for making Oyate Today a part of your night.
You've been watching Oyate Today, brought to you by Native Sun News Today.